Everyone, welcome back to another video. This week I wanted to go through another jaw technique that I like to use with patients. The masseter is one of the most common muscles that I think is tight in the jaw. It's pretty straightforward. As it opens and closes the jaw, this muscle contracts and relax. So it's constantly being taut and then relaxed. So it's a very common one. Also, when we clench, that it tightens up. Being a physical therapist, we work on movement. We're experts in movement. So I like to treat the muscles with both in a static position and when they're moving. To me, it makes sense. It's a little bit of an active release technique. I also use it on the pterygoid that I've gone through already. So I also like to do it with the masseter, and it's a super easy technique. It can be done at home. It can be done with the patient. For all patients, I like to start with doing it with them myself first versus just handing it to them and letting them go do it on their own, because it is skilled. You got to make sure you're in the right place, but it's very safe for them to do. So what we're going to do is kind of go through it here with Andrew, and I'll have Andrew open for me. Come on back together. Now with all patients, first you want to make sure in a static position that you can massage that muscle without them jumping off the table. What I found success doing is first I work on the muscle closed like this, and then I'll have Andrew open about halfway. Good. And then we'll kind of go through that for about a minute. And then what I'll have patients do is they'll have them open and close their mouth. So Andrew will just go back and forth. As he's doing that, if I find an adhesion, I'll probably hold my finger there as an active release technique. Make him go back and forth. Now, Andrew doesn't have any jaw pain, so for him, this is something that's not going to bother him a whole lot. But some patients that have jaw pain, especially with that masseter, it's going to hurt a ton. So you have to kind of scale based on the patient's tolerance. But this is a great way to release the masseter. I found success with it as patients have a relief in symptoms after. So I'm not saying it's the best technique, but for me as a physical therapist who specializes in jaw treatment, I found success. So if you haven't tried it, try it today. And if anyone's having jaw pain, please come see a physical therapist here at Freedom. Thanks for watching.